I feel so special being in Mark Twain's sort of library. This is so nice. And I'd also like to thank Florisa Zangini, who actually introduced me to Elaine, and that's why I'm here. So before I go in and start talking about Medicare, which you want to hear all about, we know, I just want to tell you a little bit about my background, just as far as being the founder and owner of Healthcare Pathfinder, and prior to that being a nurse, just where I come from. So when I'm talking about Medicare, a lot of it's about the experience in choosing your coverage. So, and Victoria Beeler's here with me. She's part of my team. But just to go back I started with volunteering as an ambulance when I was a teenager, but then went to nursing school, worked surgical trauma intensive care, didn't like the hospital too much, then went into home care for about 7-8 years, ending as a clinical supervisor there. And that's when managed care kicked in. It was sort of late 80s, and I was getting the phone calls saying, well, we'd like to approve, we allow you to visit the client for 2 days and then send us documentation back, and then we'll let you know if we want you to keep going. And I thought, oh goodness, I was like, this is a whole nother world. And so we moved to Boston, and I ended up working for managed Medicare. Well, it was actually a managed care company, Tufts Health Plan. So became a case manager and a utilization review nurse. That's the person who goes around the hospital and reviews all the charts and says, this patient needs to go home. So I kind of flipped to the other side. But as I was doing that, I was developing relationships with the case managers, the doctors at the hospital, to find out what was really going on. And that's where my passion kicked in, and started to realize that, this insurance, we can really actually have an impact on someone's healthcare experience. So it was very nice, but then we moved again. So that's when I joined a firm that's similar to Healthcare Pathfinder, which was really flipping to the advocacy side. And that was pre-Affordable Care Act, Obamacare, where people couldn't get health insurance because they'd be denied for pre-existing conditions. So we were advising people all over the country what state to move to. If you lived in Arizona, that you move to Massachusetts or move to California. So that's where our background comes from. And my team, we all have sort of a different experience within the healthcare space, as far as whether it was working for an insurance company. Teresa's claims management expert, so she's been in the healthcare space, working for insurance companies. And Ginny, who also has worked in assisted living communities and home care and all of that. So we really look at the insurance side from a very comprehensive, holistic view. So that's where I'm going to come in and start talking about this, because, and I'm going to share that there's so many other resources out there, that we're a healthcare advice and advocacy firm. We charge for our services as consultants, but there are people who provide similar services, advice services for these transitions. So if you have more questions about that, if I don't talk about that enough, you can ask me at the end. So Medicare Open Enrollment 2025. This presentation, it's gone from 2020 whatever to so now here we are at 2025, which is a big year. There's been a lot of changes. So it's very important this year to be really thinking about what your plan is for 2025. So I'll just dive in. I want to go back to some basics just to make sure you're in the right place and your open enrollment is appropriate for you. So this is for people who are currently covered under insurance, Medicare. They're already enrolled. This is not their initial enrollment period, their first time where they're enrolling. So as someone already said, they're not 65 yet. So at that time, they'll have a initial enrollment period. So we'll just focus on the open enrollment is from October 15th to December 7th. And you'll be able to start reviewing policy coverage on the websites, on Medicare.gov website, starting, I think, October 1st. So, but let me go back. So this is for people who are currently enrolled in Medicare and people who want to make sure they have the best plan for their healthcare needs. So be thinking about that. So it's not for people who are turning 65, not people who don't have Medicare now and they forgot to enroll in the right time, or maybe they retired and they were on the wrong plan, they went with retiree benefits but forgot to follow the rules with Medicare, going back to currently enrolled in Medicare, and this is an opportunity to make changes. So I want to go through just to explain, and this is going to help to understand the difference between just Medicare. There's original Medicare is considered Medicare Part A and B. And then along came the supplement plan that covers the 20% that Part B doesn't cover, but it also covers other costs under Medicare, like a deductible if you end up in a hospital. So Part A is your standard hospital coverage with skilled nursing facility or rehab nowadays. Hospice doesn't cover assisted living. It covers hospital, skilled rehab, and hospital, sorry. And then Medicare Part B is outpatient services. So MRIs, physical therapy, outpatient, any type of outpatient services. And then you have your prescription drug coverage, which was added in 2008. And I always remind people of that because there was no prescription drug coverage prior to 2008. So I'm saying 2006. So it was 2006. So that's what you have to remember when we're going through all the different history of Medicare, that it's pretty fortunate that we now have this prescription drug coverage. Okay, and then there's a supplement plan that can supplement Medicare coverage. It's not a secondary coverage. Sometimes people think if Medicare doesn't cover it, then you get the supplement plan. It only supplements the benefits that Medicare covers, but there's a cost where there's a gap. It also does provide some catastrophic coverage as well. And I will dive deeper into that later. So then we talk about the Medicare Advantage plan, which everyone knows what a Medicare Advantage plan, or at least what the name is, because the commercials are out there all the time, encouraging the Medicare Advantage plan. So Medicare Part C is a Medicare Advantage plan. The Part C is it's all packaged together. Packaged A and B and sort of a supplement, and Part D, prescription drug coverage, may or may not be part of that Medicare Advantage plan. It's very similar to what you currently had or have when you work for a company, or even if you have individual coverage. So it's got the network, so you are insured under United Healthcare or Aetna or an insurance company, and you've got a network. You've got the United Healthcare network. So there's HMO, meaning limited network. It may be just the Danbury Hospital network, or there's PPO, where it would be PPO for United Healthcare. So doctors, providers who accept the United Healthcare, but if you go outside of that, then you're going to be paying higher pricing. So it's just a little more complicated. So under original Medicare, if you go to a Medicare contracted provider, any Medicare contracted provider, or skilled nursing facility rehab, you are in the Medicare network. It's all over it's national. Does that make sense? Okay. So in addition to what I just described on the Part C side of Medicare Advantage, so there's the Part D is often included, but then you have other benefits. And this is sort of the big selling point for Medicare Advantage is the vision, the dental, and now they have some home care type of benefit. These benefits are great, and I'll try to be somewhat objective, but you do have to understand what I said before. It's very similar to the group coverage that you used to have or you have, in that when you go into the hospital, they are reviewing that stay from the start, and they're approving only a certain amount of days. And they're going to approve whether or not you're eligible to go to that rehab. If you have going to have an MRI or a CAT scan, it needs prior approval, and you may wait 48 hours before it gets approved. Under Original Medicare, you don't have that experience. The providers are making the decision. If they make the wrong decision and it's not covered, then they don't get paid. So that's a big difference in who is making decisions based on your care. Okay, I know that was a long explanation, but does that make sense? Okay, good. Okay, then I just wanted to quickly sort of give you an idea, and again, you'll be able to see the presentation again, and I can share more details, but I just wanted to give you this range. With Medicare, Original Medicare, you pay for Part A and B. Well, Part A is usually you don't have to pay for it. If you've worked for more than 10 quarters, then it's they say free, but you paid for it. You paid into it. And if you did not work or you came from another country, you may pay $500 plus every year for a monthly premium. Part B, which you still have to pay for under the Medicare Advantage plan, so you have to pay that Part B premium, IRMA. I don't know why I said $419 over here. I don't know what I was. Oh, I know, because you don't have that the premium included. So for Medicare Part B, you pay right now base $174, depending on your income, up to $594 based on your income. And on the Part B IRMA side, you're not paying that base amount. You're just doing the income-related monthly adjustment, okay? So I know this is really like, you can look at a chart to see where you fall as far as where you qualify, and you get that with Social Security. You'll get a statement, if you haven't enrolled yet in Medicare, you get a statement telling you how much your premium is going to be for Part B Medicare. And then going into Part D, prescription drug coverage, you've got the Medicare Advantage, where it's maybe a zero premium, but you still are going to have an income-related monthly adjustment. And it could be zero, depending on your income, or it could be $81 a month. And there's about 6 different tiers between that 0 and 81 and 0 and 505, or 594. And then with Part D, you will have a deductible included in that. So I'm just sort of throwing in all the costs. Then going down to, I'm just going to stay Original Medicare, going down to a supplement plan, there's plans that have a deductible. They have $3,000 annual deductible, and they have some that have none. So your premium may be $83 or maybe $263 for sort of the best plan that covers really 100% coverage. And then if you go over onto the Medicare Advantage plan, you have out-of-pocket expenses. So you may have a $700 $7,000 deductible. You may have co-pays, you may have co-insurance, but the maximum out-of-pocket that the government will allow per plan is $8,850. So what I'm showing here, this range, is not all Medicare Advantage plans are gonna have this $8,000 out-of-pocket. So it's just, when you dive in and look at these plans, I'm just giving you, there's these ranges that you really have to look at as to what your financial responsibility is going to be. All right, any questions? Okay. So what you can do, if you're on a Medicare Advantage plan, you can change to another Medicare Advantage plan, or you can change back to original Medicare. So in the state of Connecticut, that's great. You can change back to original Medicare and you can get a supplement plan and you can enroll in your Part D plan. If you're in another state like Florida and you want to go back to original Medicare, you may not be eligible for a supplement plan because they can deny for pre-existing conditions. So you have to be very careful as to what plan you choose because of what depending on what state you live in. I'm not sure if we have people who are out of state who are listening outside of, virtually. And then with Part D, you can change your prescription drug plan. So that's pretty straightforward. Now, there's a lot of changes that are going on that may impact. So we've got, and I always blank on what it's called. I brought my cheat sheet for me. It's the, what's it called? Oh, the Inflation Reduction Act. I was trying to remember what COBRA stood for today, but the Inflation Reduction Act, I think you've all heard about it. So, in 2023, they capped the insulin, it's only $35. So what they're doing now is capping Part D. Has everyone heard this? That prescription drug costs will be capped at $2,000. And how that's going to, you still will have a deductible, but you're going to lose, there's a donut hole that they used to have, or will lose that. And then they haven't determined how you're going to do it yet, but you won't have to pay all of your cost at $2,000 the first time you go pick up your prescriptions. It basically, you can choose options on paying monthly if you want. So those are just changes, and I'll again dive into this more. But just to go back, what you can do is you can change your Medicare Advantage plan. You can choose another one, and you're going to have to look very closely because there's going to be a lot of changes in those plans as well. You can go back to original Medicare. And with your Part D plan, you can change to another. And again, you will be getting, if you haven't gotten it already, within the next week or two, you'll be getting a statement from your insurance company telling you whether or not your plan is changing and what the changes are. So you should be looking for that in the mail. And just related to the Medicare Advantage plan, if you do change it, you can always change, you have a Medicare, you can change the Medicare Advantage plans that you enroll in. You can get off of it from January 1st to March 31st. So that's just an opportunity. If you didn't choose the right plan, you can make a change there. Okay.
I have a question. What's like the number one reason that people would want to change their plan?
Couple of reasons, which I'm going to dive into that, is pricing, as far as what happens with the premium. May have a different health situation where you're going to have surgery next year, and you may have a high deductible plan that you may want to move to a lower deductible. Even for adult children out there, often their parents get sick and they're sick and tired of dealing with bills and all the different deductibles and co-pays and co-insurance, that they just want their parents on a plan that's easier to manage. And they'll pay the extra money if need be. And I actually have clients who are just like, my sister told me to get the plan that my parents had, the one that just covers everything.
Can you go from original Medicare to the Advantage?
Yes. Yeah, exactly. Yes, thank you for pointing that out. So how to compare plans. Does everyone have, are you registered on the, well, I know you're not, but registered on the Medicare.gov website? It's a great site to see your coverage and get confirmation of, even if you change plans, that's the place to go look to see. So it's Medicare.gov, and it will show you, it'll show you your premiums. You can pay your premiums on the site. You can have authorized representatives. You can add into the site. You can see all your claims, and then you can also go to your, if you are on a Medicare Advantage plan, then you need to log into the Medicare Advantage plan. Medicare.gov will not have the claims information, but they will have your insurance information in the Medicare.gov site. So there's a plan finder. You go to the plan finder in the Medicare.gov website to go in and make your search and choose your plan. So then what I want to do is go into reviewing and comparing plans to what's most important, instead of going into the details of the website and trying to focus on the how to do it, which I think is important to talk to people and get advice before you just go and change the plan. As Victoria just had someone went off, we gave some advice, and they went off and enrolled in the plan, a plan by themselves, and they enrolled in the wrong plan. So you really just want to make sure you're enrolling in the right plan. So in reviewing and comparing your plan, the questions to ask are for Medicare Advantage plan. Okay, so again, let's just frame it where the Medicare Advantage plan, this is if you're on one or if you're going to look at one. The difference is under original Medicare, the only deductible you have on original Medicare is if you go into a hospital and you have it's about $1,600 when you go into the hospital. And that supplement plan usually covers that, depending on what plan you're on. Okay, so that's sort of the original Medicare. Under the Medicare Advantage plan, these are the questions you need to focus on. What is the deductible? It could be anywhere from $0 to $7,000 plus, $8,000. Co-pays, and this may be based on premium. If you have co-pays and there's a low deductible, you may be paying a higher premium. Co-pays are nice because you go to your doctor, you're going to pay $20 for that doctor's appointment. You go to a surgeon, you're paying $40. All these different plans, some have $10 copay, some have $20, some have $40, $50. They're all different. Co-insurance is when the plan pays a certain percentage and you pay a certain percentage. They may pay 80%, then you pay the 20%. But all these costs go towards meeting your deductible. So you want to ask those questions, be looking and comparing those costs. The premium, you see a lot of zero premiums for Medicare Advantage plans, and annual costs. So annual cost kind of goes back to what's your maximum out of pocket. So premiums really can vary here. And what you'll see there, it can be so confusing because you can have the zero premium, you can have the high deductible, then you've got usually don't have the co-pays. So you really kind of have to, you can often actually go through and they'll ask you questions as to how to search your plan based on what your needs are. And then provider network is key. Your list of your doctors, and call up the doctor's office. Don't just go onto the website. and look to see if your doctors are in network. Call up the doctor's office. Some doctor's office may say, I don't know, and say you get their NPI number and you call up the insurance company and ask them if this doctor's in network. But the providers is very important. One of the biggest reasons why we switch people off of Medicare Advantage plans is someone gets sick, they're in the hospital, and they want to go do such and such rehab, and it's not in network. Or there's only 2 in network and they're not the ones that they want to go to. So really need to, not just your doctors, call up the rehabs, you can go online, but really research that clearly. Especially if you're in Connecticut and you want to go to New York. Got to check the network on the hospital, to see, in the individual markets, you can't necessarily go to Sloan Kettering. It's not in network. So that I would say would be probably one of the most important things to do. And then looking at these other benefits, the prescription drug coverage, RX, prescription drug coverage, dental, vision, home care. These benefits are great, but I would focus on the networks before you start going into choosing it, because of the hearing aids are, $6,000. Really have to balance that $6,000 hearing aid with a $7,000 deductible is not necessarily the best plan that you want to be choosing, unless you know that this works. But very careful about that. Then if you're looking at your prescription drug plan, and again, that's also another thing to be careful with the Medicare Advantage plans, is that when they have the built-in prescription drug plan, you really need to make sure that's the right, when you choose a plan, you need to make sure that your prescriptions are covered under that. You don't have a choice. With that prescription drug plan, it's built into the Medicare Advantage plan. And those plans are all different, depending on which Medicare Advantage plan you go with. So going to your current Part D. So just for example, last year with the reviews with our clients and changing plans last year, and we're not a huge company, we'd saved almost $200,000 worth of clients' money. We saved for them by changing them to a new plan. And the reasons why we ended up saving the money is that the plan they were on, this was made number 1, was the plan they were on, prescriptions dropped off and were no longer covered under that plan. It's very expensive plans, like prescriptions, like Eliquis, and I'm trying to think of some other, Ozempic, and things of that, medications of that sort. So if you've been on plan a long time, like if you've got parents that are still on the same plan that they enrolled in 2006, they're probably paying $130 a month, and maybe their medications are the best and it's the best plan for them, but a lot of them probably not. So you want to look at not just yours, just protect your relatives as well. Premiums and annual costs. So the premiums and annual costs, this is where it's going to get a little confusing, but at least you're protected with $2,000 cap. But that $2,000 cap, we're not sure what the prescription drug companies are going to do as far as marketing this, and they may be dropping prescriptions off of the formulary where they're not going to be covered anymore. They're going to be increasing their premiums. But when we're talking about a Part D premium, we're going from a 50-cent premium with WellCare. I don't know if you've heard of WellCare. They got everyone to join WellCare because they had a 50-cent premium and an excellent formulary. So it'll be very interesting to see what they do with these changes, because they got all these people and they're going to increase their premium, and they're going to, we don't know what formulary is going to look like. So they'll automatically roll people over into the new plan, or the same plan but with a higher premium. And people think, oh, well, good, I've got coverage. You can't trust that. So, of course, are your prescriptions covered? And when you go into the Medicare.gov website, in the Plan Finder website, they actually, if you're on original Medicare, they have all your prescriptions already in there. And you can just go in and do a search. And then, are there limits and restrictions? So this is another area you need to look into. Not is it just covered, but this medication you've been on for 5 years, they're all of a sudden saying, well, we think you need to try something else first. We're not going to approve for you to continue to be on this prescription. Or they're going to say, we're only going to allow you to get 30 days filled versus 90. So again, when you're looking at this, you need to look into it in depth. All right. Any questions on that? All right. Medicare supplement plans. So, is anyone on a Medicare supplement plan currently? Okay. So, again, these plans get older. And so you need to look, how long have I been on that plan? And if you look at what plan, these are the J and an F. The J and the F shows your age, because you can't get that any longer, and it's really for people prior to, I can't remember. That's F. I forget when the J, I think it was maybe 2008 or something of that sort. But so J is no longer, but people may have it. You can't enroll in a J. F, you can enroll in if it was prior to, if your birthday was prior, 65th birthday was prior to 2020. G is the best plan you can get now. There's currently a $240 deductible for the year. So going back to sort of, and then K and L and M, these all have deductibles, different experience, or they pay 50%. It's like you have to share with the company as far as the cost is concerned. And then Plan N is copays. $20 copay for every doctor visit, unlimited. So if you get sick, you're paying copays, copay, which is, maybe that's fine. But the prices are very different. And as I sort of had gone and shown sort of that range in the first plan, description of costs, it can be anywhere from 83 to 300 plus, and again, depending on what state you're in. So this is what you need to look at, and people if you're on a Plan F, you don't have that $240 deductible, but you may be paying $100 more a month for that plan. So you can switch to another one. But be looking at these, the different options. And just again, to remind you, the supplement plan supplements, so say Plan G, it's going to cover that $1,600 deductible if you're in the hospital. It's going to cover that 20% of the Part B. The doctor's office that only covers, Medicare covers 80%, is going to cover that 20%. It's pretty much like 100% coverage, really, with these Medicare supplements if you go with a Plan G. The other ones, as I said, have deductibles, co-insurance, or copays. Then the other thing, what's very important is Medicare. I don't know if you all know that if you travel outside the country, you don't have coverage. There's no coverage under Medicare. So it's very important for the supplement plan. It has a $50,000 benefit that will cover you outside the state. Outside the country. Anything? Oh, I know. The other thing that I wanted to, in relation to the Plan G, Plan G, is there's a catastrophic benefit. So when you go through all of your Medicare days, God forbid, there are a maximum amount. I didn't go into the details of that because it gets a little complicated, but you do have a maximum benefit. If you continue staying in a hospital, they have a limit on the number of days that you have. And basically, the Medicare supplement plan can pick up 360 days as catastrophic coverage after. So that's very important as a benefit if you are thinking catastrophically. Okay, when a change is made, this is where it's very important as well. Not just choosing and making the change, is making sure you actually enrolled. And did you get enrollment confirmation? Nothing worse than thinking that you enrolled and you just didn't push that extra button, or something happened in the system. You should get, if you do it online, you should get confirmation, and you should get an email, or you'll get documents in the mail, and then paying your premium. So you have options to have, if you're getting Social Security Social Security benefits, Social Security benefits, you can opt to have your prescription drug premium taken out of your Social Security benefits. With Part B, it's automatically taken out if you're already getting Social Security. If you're not taking your Social Security benefits, then you have to pay Medicare. And that goes back to the website where you can pay online, or you will get a statement in the mail with what you owe for premium, and you pay quarterly. Okay, any questions? No? Okay. So as far as resources, sorry, I just want to make sure. As far as resources are concerned, you can call, there's Choices, which is SHIP, that's the Medicare, and I'm sorry, I didn't put the number down, I should have done that. I can provide those resources if you want me to. Your Human Service Department, I don't know, does the library, do they provide any type of open enrollment support, besides my presentation?
I'm not sure.
Okay. Area on Aging, they actually are connected to the Choices program for the state of Connecticut. And it's called SHIP. And then there's brokers. Brokers who sell insurance, and they can help with doing your searches as well. They get paid by the insurance company. They do, so they're not charging fees, but they get paid by the insurance companies to sell their insurance. The important thing with brokers is ask them how many companies they represent. Because if they only represent one, you want to be talking to someone else. If you're looking at Medicare Advantage plans and even supplement plans, you can be paying, and I actually have information, I have sheets, actually I'm going to put over there, that will show you the plans, the different supplement plans, and the premiums. So if you have a Plan G, the Plan G is going to be the same with AARP United Healthcare, with Anthem, with Colonial Penn, with Cigna, with Colonial Penn is Bankers Life. Those benefits are the same, but the premiums could go anywhere from $260 to $600. So, and that's legal. So you have to be really careful as to, when you're talking to brokers. And I'm not saying brokers are not good at all. I'm just saying you just need to make sure you know what companies they represent and that they represent more than one. And then Healthcare Pathfinder. And we are a fee-for-service healthcare advice and advocacy services. And I'll go to my I'm sorry, but stress caused by trying to figure out your health insurance is not covered by it. So get help and support. What I can do, which I'm not on my own computer, and it probably would be something separate I'd do with all of you here versus virtually, is go onto the computer and show you a little bit more detail. Is there any way I can go into the internet here?
Yeah.
I just don't, I'm good to jump off of this.
Okay.
And what I wanted to do, where did I? Oh, here it is. Sorry. Oh. You just put in Medicare back up, see how it goes. Great. That's okay.
You good?
Here, I'll just make it a little bigger here. There. All right, let's get rid of this. Okay. So when you go to Medicare, you can go into login up here and register on the Medicare website. And then this is just, I'm just going to show you quickly, this is where you can go to health and drug plan. And you could go to find, you can compare coverage options, find Medicare supplement. That is a little confusing to do on the website because it usually tells you just to go to the insurance websites, but it will tell you the options. I've got the sheets here for you that's got the premiums and the different types of plans. And what I just wanted to go, so you go in here, and this is where you start your search. And you put in your prescriptions, even if you don't have, if you don't even have a Medicare ID number, you can go in and play around in here. I can't go in because I could not use a client's information. But when you're going in here, just really make sure you're understanding not just the premium. You want to check to make sure your prescriptions are covered. You want to make sure that there's not a tier, like it's a higher tier. You're going to compare that. But also, are there prior authorization? Are you going to need it to be on another medication before they're going to approve it? Are you going to have to get a doctor's prior approval for your prescriptions? Very important to be looking at that. And what I didn't include is pharmacies, comparing pharmacy. Don't just put your pharmacy in. You want to be putting in a couple different pharmacies to see what the pricing is for the different pharmacies and whether or not your pharmacy is even covered. Because some people do, they just change plans just assuming that CVS is the best plan pharmacy, and they may not even be a network or they're not preferred. So that's very important when you're talking to people if you're getting advice. So I just wanted to share that with you. And then I just also for takeaways, I just wanted to go back because you'll probably be hearing a lot, more about the Inflation Reduction Act. I could just get that name into my head, that would be great. But there's going to be that $2,000 cap with the Part D, no donut hole for all of you who are on a lot of prescriptions. You'll be happy not to deal with that. So a big, looks like we got a healthy crew in here, but that Ozempic or those medications that have been covered for weight loss, they're going to, they've been able to negotiate costs on that, and they're going to be basically, if you have diabetes, then you can get coverage for it, but you still have to qualify for diabetes, but they are working to provide more benefits for people for those medications. The Medicare Advantage plan, this is just basically highlights that they probably will not stay the same, but they will also be sending out a statement, required statement in, I think, mid-year statement, telling you what benefits you haven't taken advantage of, which is nice, which is going to be dental and vision and hearing and things of that sort. Also, there will be $2,500 eligible for respite care for caregivers who have family members with dementia. Only problem is there's only a limited amount of providers in the state of Connecticut. Their providers are available up in Hartford. They're working on expanding that. And then on the mental health side, they've mental health providers have been denied a contract with Medicare, and now they're encouraging them to become Medicare providers. So those are kind of the major highlights on that. Also, they're going to be expanding eligibility for financial assistance under Part D, and that's based on income. So that goes through Social Security. So we were just having a conversation with a client about that, and he has an F, or he's eligible to enroll in an F because he's turned 65 before 2020. You have to look. It depends on if you're in here. I can just pull it up here. In the state of Connecticut, if you're on a Plan F, which has no $240 deductible, which you have now, okay? That's $300, I'm just doing AARP United Healthcare, $353. There's one year that's $307 a month versus the lowest one here is $247. $277. So you're saving about $50 to $100 depending on what plan you go on a month. So it's whether or not you want to save that $100, depending, again, it depends on what company you're on, because it's very easy if you're on, say, AARP United Healthcare. Say that's the plan you're on, and you're on Plan F, and you say, I just want to go to this Plan G because I want to save $100 a month. And all you have to pay is that $240 deductible that year. So you're saving a fair amount of money. So that's the only reason to change, would be that you want to just save money and premium. The benefits are the same.